Hello, and welcome to another episode of the Ask Dr. V podcast. I'm your host, Dr. Linde, and I am extremely passionate about helping you to live your full potential in health and wellness. I just want to pause before we carry on with today's topic to say thank you so much for all the feedback I received on the sleep episode. I'm so glad it helped some of you, and we're looking forward to introducing another topic. Today, we have a jam-packed episode regarding a taboo subject, Botox. We're going to answer a question I hear so often, especially amongst the more conservative. Isn't botulinum toxin bad for you? We'll also chat about when and how it was discovered, all of its uses, including for the effective treatment of bruxism or teeth grinding, migraines, hyperhidrosis or excessive sweating, and even muscle spasm and spasticity. We'll cover the various kinds of botulinum toxins on the market and why it is such a popular aesthetic treatment. So, botulinum toxin type A, made famous by the big pharmaceutical company Allergan, now owned by AbbVie as Botox, is a potent neurotoxin that is produced by bacteria. Interesting, so it's naturally produced. This little bacteria, called Clostridium botulinum, is commonly found in swale, on plants, water, and in the gastrointestinal tract of animals. It was first used in a clinical setting or doctor setting by Dr. Scott more than 40 years ago, where he effectively treated strabismus. Strabismus is basically crossed eyes. In a series of injections around the eyes, focusing on certain muscles, he was able to effectively treat strabismus in various patients. After his study was published, Botox was registered by the FDA, which is the Medicine Control Federation in America. It was registered as an effective treatment for various conditions of spasticity or muscle spasms. As for aesthetic and anti-aging medicine, it's been an FDA-approved treatment for frown lines, forehead lines, and crow's feet, all those wrinkles around your eyes, since 2002. So it's more than 20 years of clinical data, of safety produced, and various uses by multiple doctors and clinics worldwide. This means there are obviously multiple clinical studies noting that in certain doses it is a safe and effective treatment for wrinkles. Botox or botulinum toxin is one of 8 different types of botulinum toxins known to exist. They are from type A to type F, A being the most potent, and that is what we use. Basically, how it works is it stops the neurotransmitter acetylcholine from being released. Acetylcholine is found in the nerve just before the muscle and is responsible for causing muscle contraction. In between every nerve, which is an extension of the brain really, and a muscle is a little gap or a bridge. Now, acetylcholine cannot cross this gap alone. It needs a transport molecule. Think of it as a passenger that crosses over a bridge, needing a taxi to get from one end to the other. What Botox basically does is it causes a taxi strike and all the taxis disappear. The passengers are still there, but the taxis disappear and thus muscle contraction stops. Now, these taxis can take up to a week to disappear. That's why you will only see the results at 7 days. Sometimes as early as 3 days, but full effect at 7 days. So acetylcholine buildup occurs in the presynaptic cleft, which is in the nerve, and it cannot cross because of the transport molecule. It cannot access that transport molecule. I think that's the best way of simplifying it. In more scientific terms, it cleaves the SNAP25 and the synaptobrevin molecules, to which it causes endocytosis or exocytosis, across the intrasynaptic cleft, and then binds onto postsynaptic receptors on the muscle cell, causing muscle contraction. So, yes, that is how it works. The body's super clever and then creates more synaptobrevin or SNAP25 after a while to assist the acetylcholine transport, or basically gets more taxis to assist the acetylcholine. And as soon as there are enough taxis again with all the acetylcholine passengers, they get on board and muscle contraction occurs again. So it's a semi-permanent treatment. It's not reversible in that once you inject Botox, you cannot reverse its mechanism. So once you've injected it. But the body responds by increasing receptors. At about 3 months, there will be full effect of that muscle contraction again. So we've spoken about the various types of botulinum toxin, and they are commonly associated with systemic botulism in humans, and that's the title of today's talk. Botulinum toxin can cause botulism. Isn't it unsafe to use? Let's quickly review what botulism is. Botulism is a very rare condition caused by consuming foods infected with the bacteria of botulinum toxin, the Clostridium bacterium we spoke about earlier. And originally it was used as biowarfare by infecting enemy food with the bacteria, which ends up causing dizziness, fatigue, blurred vision, difficulty opening eyes with that muscular effect and more. Each of the various types of Botox work in a similar fashion, but as mentioned earlier, type A is the most potent. Botulism usually occurs in infants under the age of 1 who do not yet have protective mechanisms in their tummies to protect against bacteria, which is usually found in raw food and oxygen-free environments like tinned foods. So in older people, we do have something in our stomachs that sort of demobilize and get rid of botulinum if it is present in our gastrointestinal tracts, but infants under the age of 1 don't. So that's why things like raw honey should not be given to infants under the age of 1. So the best means of preventing botulism is by adequate food preparation, by cooking it thoroughly. Botulinum is destroyed at oven temperatures above 120 degrees Celsius for about 30 minutes. So adequate food preparation, you're good to go. In prepping for the podcast, I found an interesting article published in 2018 in the Baltimore Journal of Medicine, which reported 86 cases of botulism after Botox injection. The sites injected were mostly off-label and included the upper arm, calf, and other sites for cosmetic purposes. I don't quite understand the calf or the upper arm. These are both areas that significantly are associated with health and fitness in the Western culture, but alas, they injected these areas. Most patients that had any symptoms of botulism, of which the most commonly reported was a little bit of dizziness, fatigue, and headache, most of them received more than 200 units and some over 500 units of their treatment. All of the patients in the paper fully recovered, which is very, very good. And most of them didn't need respiratory tract support. I think there was 1 out of the 80-something patients that were recorded. And that patient received 1,000 units of Botox, which number 1 is generally unaffordable, and number 2 is extremely, extremely high doses, which we don't use in a clinical setting. In clinical settings, we use anywhere from 10 units to 80 units for cosmetic results. The frown, for example, on-label indication is maximum 20 units. The forehead is 20 units. And per eye, 12 units. That's what we use in a clinical setting. So these people were getting up to 200 units, 500 units, 1,000 units, which is way, way over, and I do not recommend that. There is an additive effect. So if you come for Botox today and you want to come again in 3 weeks' time, but you've already reached about 100 units at your first injection, then it would be wise to delay your appointment and only come later then, because there is an additive effect. However, I've never seen botulism, and in South African environment, we haven't had any reported cases of botulism in the clinical environment after injecting botulinum toxin of whichever brand. So yes, in extreme doses, it is unsafe to use, but we stay way under that. The product itself has obviously been under rigorous testing to attain that rigid FDA approval, and a plethora of studies have been conducted to verify its safety. And again, in extreme dosages, it does act as a poison and cause botulism, but in the very conservative dosage we use for clinical and cosmetic use, it is very safe and found naturally in our environment. What's funny to me, always a little funny and somewhat ironic, is when people are scared of botulinum toxin because of the word toxin in it. But do you even know what all our favorite gassy beverages contain? One of the main ingredients in our favorite cola drinks is phosphoric acid. Now, phosphoric acid is a potent corrosive agent. In other words, it causes corrosion, burns, and ulcers. Regular intake has also been related to conditions like osteoporosis in middle-aged men. However, the regular use of botulinum toxin has released in decreased rates of depression in middle-aged men and women. So just some food for thought. just to be aware of what you're consuming in terms of your information that you're consuming, what you're putting into your body and into your face. Just be aware of all the actual data and the actual mechanism of action of how these things work. Once we understand how things work, we know how safe they are or unsafe they are. Also, all the various ingredients and various things that we consume. I'm a fan of a clean diet, of eating clean, of consuming clean, so staying away from any gassy cold drinks, because I'll be honest, I can't pronounce most of the ingredients on my favorite cola beverage, so I can't imagine it to be very good, and there's a lot of data to support that. Anyways, back onto botulinum toxin. So we inject a different kind of botulinum toxin as reported in that study done in the Baltimore Journal of Medicine. However, there's various brands found in South Africa and around the world. Locally, we have Elegance Botox, we have Ispin's Dysport, and then we have Xeomin, which is the new kid on the block from the UK. What's nice about Xeomin is obviously it doesn't need a cold chain, so you don't need to keep it cold. So if doctors order it, they'll probably get it the next day. It's quite a stable molecule. But I particularly like Elegance because it is the original one that was launched. And I've seen good effect in my clinic, so we tend to stick to that. But there are other brands available. Only available overseas are Neuroblock or Myoblock, Elan, and others. Okay, next up, how do we inject botulinum toxin? A teensy-weensy 30-gauge needle is injected into the muscle of choice. For the found on-label dosage, as I mentioned earlier, is about 20 units. Don't worry, this doesn't mean 20 different injection sites. It usually means only up to 5. And we do have a medical grade anesthetic cream applied beforehand. But the procedure really is quick and it's comfortable enough to go without it. I know a lot of anesthetic injectors do inject themselves, so it really is comfortable enough to do it. Without the anesthetic cream, however, that is available. If you're like me and you're not a fan of needles, then a very good idea to get that cream. The larger the muscle or target area, the higher the dosages. And this is a generalization. It's at the discretion and experience, obviously, of the injector. In South Africa, the only people allowed to inject are medical doctors and dentists that have training in Botox. So, whereas, for example, in the UK, there are nurse injectors and there are people that go on a 1-year course to be able to inject, which is at the prerogative, obviously, of the UK Medical Council, but I would not advise to be injected by anyone other than a trained medical doctor or a trained dentist. It's very, very dangerous. You could put it in the wrong area. You could inject it intravascularly. And obviously, doctors and dentists are trained to deal with those complications. It is, after all, a medical procedure being injected in a medical means. So you want to be as safe as possible when you're injecting it. So yes, very, very, very important. One of the conditions effectively treated with botulinum toxin with up to 9 months of longevity is hyperhidrosis or excessive sweating. With treatment done in early spring, this treatment obviously can keep you dry the entire hot season, which is a lot of relief for especially a lot of people living in the low felt and in South African context where it's very, very, very hot here. It can keep you dry the entire hot season. A lot of people are obviously concerned about the supposed redistribution of sweat if these glands are inhibited. But your armpits or underarms and axilla only account for 2% of your total body sweat produced. So that redistribution occurs really without any effect and doesn't have any long-term negative effects. Another condition effectively treated is bruxism or teeth grinding. If you can, put your forefinger or pointer finger at the edge of your jaw, about 2 centimeters in front of your earlobe. Now bite on your teeth. That's a muscle causing most of the problems with clenching. That's called your masseter or masseter muscle. And strategic placement of the toxin on this muscle causes it to relax without affecting your eating. So I've got a few patients that we do treat for bruxism or teeth grinding, and it also helps with those headaches. You know, those headaches related to grinding on your teeth. It also helps with temporomandibular joint disorder. So very, very effective treatment, and that is an on-label indication. Migraines are similarly treated, but it's usually in muscles of the forehead, muscles of the temple, and just above the forehead that are injected. There's various points, pressure points that we inject there, and that's also usually on label. It usually says about 3 months, obviously because of the production of those new receptors, but some patients can have effect up to 6 months. We don't promise that. Our promise is always 3 months, but if you're lucky enough, up to 6 months. So those are other conditions that we treat. Obviously, at the beginning, it was indicated for strabismus, which is that crossed eye, and this is usually done by an ophthalmologist. So, for example, I don't do it as a medical aesthetic practitioner. I refer patients to an ophthalmologist who are trained in it and in the various pressure points and obviously the muscles of the eye to correct that. Okay. What are some of the post-procedure care tips? Because every procedure does have some post-care. So first one is to avoid rigorous sweat-forming exercises for 4 to 6 hours after your treatment. And this is mainly to prevent the spread of Botox. So Botox, once it's injected, sort of spreads in about a 2-rand point fashion around where it's injected. So we are quite precise. There is a bit of spreading that happens. But when you exercise rigorously, blood flow changes, your muscle contraction changes, and that can spread a lot further, causing dreaded things like ptosis or your eyelid drooping, or a Mephisto where your eyebrow is raised. We think of the Star Wars character Mephisto. That has happened before and does happen if Botox is incorrectly injected or injected too laterally or too exteriorly on your eyebrow. You might get a Mephisto reaction, but that's also why we say to avoid rigorous sweat-forming exercise. We also want our patients to avoid lying down for 4 to 6 afterwards for the same reason. Obviously, this is an injection made in the face with a needle, although it really, really is very small. We recommend to avoid applying makeup onto the treated area for the rest of the day because there are still injection points and we want to avoid contamination and avoid infection. Remember, the skin is alive with microorganisms, mainly Staphylococcus aureus, and when it gets displaced or goes into the wrong place, causes infections like cellulitis or carbuncles, and we want to avoid that. So those are our recommendations and some of our post-procedure care tips that we give to you at the end of your visit within my clinic. And as mentioned right at the beginning, Botox takes about 7 days for full effect. So you'll wake up the next day after your treatment and you'll notice no effect. At about day 3, you start feeling a heaviness in the area. It's quite bizarre, and if you've never had it before, it's a little bit difficult to explain, but there'll be sort of a heaviness where you can't use that muscle as regularly, and as the botulinum toxin takes effect, you are unable to use those muscles. Obviously, the lower the dosages we use, the more expression we're able to maintain, and I'm a fan of this. I like natural results. I still want to keep emotion in my patients' faces. We don't want to do that ironed out effect. So we tend to use lower dosages. However, it's important worth noting the lower the dosage you use, it's also linked to how long it will work. Again, related to that receptors that we spoke about in the beginning, or those transport molecules being formed again. So yes, that's generally our approach, and that is botulinum toxin. No, it is not bad for you. It can be bad in very high dosages. We know it's been around for more than 40 years. We know what toxic dosages are versus those we use in clinical practice. We also know Botox beyond aesthetics. Just to quickly touch on the aesthetics, on-label indications are for frown lines, forehead lines, and crow's feet or periocular, or those lines around the eye. When you smile nice and big, you can look in the mirror, those little lines around the eye. And then we also do treat things like a gummy smile with Botox. We treat, we sort of cause the chin to drop if we inject it under them. That can be quite nice when you're aging, because that muscle tends to get quite strong. It tends to pull up, causes a bit of a witch's chin. So a little bit of botulinum toxin placed in the right area within that muscle causes it to relax beautifully, and it causes a nice softening of the jawline. We could also use it for bunny lines, or those lines when you sort of scrunch up your nose while you're smiling. I've got a lot of patients that have quite prominent bunny lines that we inject. And then one of the other main ones we use it for is for an upturned smile. So a lot of ladies, as we age, obviously various factors, your skin, your bone, your fat, everything sort of changes shape and changes position within the face, causing the smile to look downturned. So you've always got this sad smile. One of the muscles involved in that is the detrusor angularis RE, or the DAO or DOA. And if you put a little bit of Botox in that area, that muscle relaxes, so there's no pulling down effect on the smile, and in turn, the mechanisms that cause it to pull up take over, and you get this upturned smile, so you're permanently smiling. What that does is it creates a positive emotion on the face, and with any aesthetic treatment, really, it's not our heart to change what you look like, but it is to bring about more positive emotions in your face. So the frown line is associated with looking mad or bad. The lines on your forehead and around your eyes are associated with looking sad or tired. And basically, the goal with aesthetic medicine is to create a refreshed, revived, happier look. It's very, very interesting. After a set of patients, there's lots of studies proving this. After patients were injected with botulinum toxin in their frown lines, rates of depression amongst those patients decreased dramatically, because when you look at yourself in the mirror and when you activate, obviously, those muscles, you do cause that maddening, saddening, I want to say baddening, but that's not a word, but a tired appearance. So treating that actually has a positive mental impact and a positive self-worth impact. And really, that's our goal, is to help you to live your best life, help you to live your full potential with various treatments. Obviously, there are other holistic treatments that we use, but botulinum toxin is one of the most popular that we use for that. And that's that. Obviously, the more you use it, or the more frequently you use it, the less you'll need. Why is this? Botox causes, obviously, that muscle activity to decrease, and it's commonly known that if you don't use it, you lose it. So if you're not using those muscles, they do tend to atrophy or to become smaller and shrink down. So even once the botulinum toxin has worked out, those muscles tend to have a decreased activity, which is incredible, because as time goes on, you'll either need a lower dosage or less frequent injection of botulinum toxin to achieve the main effect. I don't recommend patients coming for Botox within that 3-month window, because there is an association with neutralizing antibodies towards the botulinum toxin, which is commonly in patients with from the military that have had the botulism vaccination. Unfortunately, you will not be able to get Botox, or you might inject it and you'll have very little or no effect because you produce antibodies with it. So if you come too regularly for your Botox, or within that 3-month period, I don't ask patients to wait. Even if clinically, all those muscles are working, I don't want to be the cause of any resistance to this wonderful, wonderful treatment. And if you are from the military, or you have had your botulism vaccination, first of all, thank you for your service. We are so, so grateful for your service and commitment to our country. The next thing is to say that there are other treatments available that effectively treat those wrinkles in those areas. So there we go. Botulinum toxin in a nutshell. I hope this has been informative and helped to break the taboo surrounding botulinum toxin. And if you've enjoyed it, be so grateful if you shared it with the people in your world. Again, thank you so much for your feedback. It really helps us to understand how we can serve you better through this podcast, through educating and informing. Again, it's not meant for medical recommendations, but should be more entertaining and informative. So please, I'd love to hear from you. If you have any questions, or if you'd like to hear about other topics to do with health and wellness, pop it in the comments. We'd love to hear from you. And thank you for sharing this. I'm very, very excited for 2 weeks' time, where we'll cover another incredibly fascinating topic, where we're speaking about all things weight loss, including all the natural supplements that are evidenced to help with weight loss. So if you are struggling to lose weight, you've tried but you're struggling, then that one is for you. Until then, take care.